Great. Hi, everyone. I wanted to welcome everyone to an event made by YACCC, which is the Young Adults COVID-19 Community Champions at Merton Council. We made this event called COVID-19, Why Vaccinate? Your questions answered. And what we wanted to do was essentially just give young adults the opportunity to ask questions to health professionals, and if there was, so we've made this event particularly for that. So I hope you guys brought your questions along. My name is Martin Miranda, and I work for Merton Council as a young inspector, and I also have another co-facilitator, Lourdes.
Hello, my name is Lourdes. I'm also a young inspector. Nice to meet you guys.
Thank you. So yeah, we can move on to the next slide. Yeah, so as mentioned, the meeting being hosted by YACCC. This is an online group for young people aged 18 to 30 who live, work, or study in Merton. And it's a key part of the approach to prevent and manage COVID-19 outbreaks. What we do, what the group essentially does is just provide a platform for people to raise any concerns they have, and also if they want to find out information, then they can find out the latest information from NHS or public health. We talk about the impacts it's had on our lives, on our families, on that it's had on our friends, and if there's any messages that we want to be shared, then we send it out to them, and they can decide if they want to share it. Yes, there was a focus on young people. So there was a recent survey for the whole of South London, and what we found was that young people aged 18 to 24 were the least likely to say they would have the vaccine out of all the age groups. And so the vaccine is not just about protecting yourself, it's also about protecting your family, friends, and community, because as we know, the virus is transmitted. And yeah, so the vaccines prevent serious infections, disease, long-term health issues associated with even mild cases of COVID-19. Thank you. So just, yeah, do you want to do the agenda, Lourdes, please?
My pleasure. So we're going to welcome you guys. You're going to have a panel introductions by the panelists. We will then have the presentation given by Merhan and Sedina, and then a Q&A, and we close at 8 p.m. Just to let you guys know, over here, you don't need to take any notes for this presentation. We will be sending out PDFs following the event. For housekeeping, we want to just let you guys know that 1, you are in a safe space. Feel free to express your opinions. 2, please mute your mics when you are not speaking. 3, please put comments in the chat. Ooh, apologies. Please put comments in the chat, or yes, or raise your hand. When speaking, please do introduce yourself and switch on video where possible, and if you feel comfortable. 4, please know where your restrooms are, and 5, you can eat or drink, but please be on mute. And this workshop will be recorded for the purposes of capturing your feedback. So the panel introductions, I'll be handing over to the panelists, if that's all right.
Yes, so I think the first one we have is Dagmar.
Yes.
Dagmar, you able to introduce yourself?
Yeah. So hi, good evening, everybody. I'm Dagmar Zeuner. I'm the Director of Public Health in Merton. And you will probably wonder, because I am a doctor by breed. I used to be a hospital pediatrician, but I'm now actually not working in the NHS anymore. I work in the council. And what I'm doing around the pandemic is basically I have to make sure that we control the outbreaks. And just to give you a little bit of flair what that means, so I do quite a lot, not me personally, but my team, quite a lot of the detective work. So having the data, understanding where are the infections, who are the cases, who are the contacts, where's the infection coming from, who is at risk of getting it. So it is a bit like a detective work. And so I deal a lot with data, but I give you a flair as well. It is quite fun from a science point of view. So we're looking at wastewater, for example, as well, because the virus is in the urine, and we can track back to understand and have it as an early warning system. So that gives you a bit of a flair of that bit of my job. The other bit is obviously you've been, some of you at least, in schools or unis or elsewhere in a workplace or in a family when there is an outbreak. And we advise what to do. And in school, you will remember after the summer break, there were lots of activity around who can go to school, who can't, whether the schools need to be closed. All of this is outbreak control. Then currently the testing program, a number of you will do the testing. Others might have the testing kit on the windowsill and haven't quite done it yet. That is also my business. And then very importantly, probably our most important tool to get on top of the pandemic is vaccination. Now, I haven't, I'm not doing the heavy lifting there. It's my lovely colleagues from the NHS who will talk to you in a minute, but we support a bit. So you might be aware there were pop-up clinics all over the borough, and we help to work out where they should go. So hopefully that gives you a little bit of a flair, but I'm looking forward to the conversation and your questions going on. Thanks.
Thank you, Dagmar. Can I invite Dr. Mohan, please?
Thank you, Martin. Hi, everyone. I'm Dr. Mohan Seeker. I'm a GP at Wider Medical Practice in east of Merton. And I have been involved with some of the vaccination hubs in Merton, certainly at the beginning. And now I'm not doing as much. Sadina, who was introducing her, is still doing a lot of vaccination hubs, but I'm here to help support vaccine confidence and answer sort of any questions you may have around taking the vaccine or anything else. So pleased to be here. Thank you for inviting us.
Thank you, Dr. Mohan. Can I invite Sadina, please?
I am the chief pharmacist for the Borough of Merton, and my role really is to ensure that the vaccine is stored safely, used safely and effectively, and make sure that all the pharmaceutical aspects of the vaccination services are safe according to the law, and more importantly, are patient focused. So as Dagmar and Mohan have said, I actually work in the vaccination clinic. So I work in the 2 vaccination clinics in Merton. I work and support all the pop-ups that happen. I support the community pharmacy in Merton, and I also work in the large vaccination site in Sutton. So on a daily basis, I'm in contact with patients, clinicians, people who have questions, people who aren't sure, any arrangements around the vaccine, training the staff. So yeah, very exciting, and I meet lots and lots of people as part of my role. But another large part of my job is really doing these webinars. So together with Mohan and various other colleagues, I have spoken on various webinars, both within Merton in small groups, large groups, internationally, with colleagues and everything else that goes with it. I'm also responsible for supporting clinicians with questions, clinical about their patients and things around the vaccine, individual patient queries, general queries, and everything that goes with it. So it's been quite an exciting time as a pharmacist, because I don't normally have that much patient contact in this current job. I used to work as a hospital clinical pharmacist, so very different role now. But yes, it's been enjoyable, and I'm hoping that this session will be yet another exciting, useful session for our audience.
Thank you, Sadina. Can I invite Abisola, please?
Yeah, hi everyone. Thanks, Martin. So my name's Abby Faklu. I'm a Merton resident and a trustee for Merton Connected. That's our voluntary services council. So for those that don't know us, we are responsible for really supporting, enabling, championing the voluntary and community and faith sectors in Merton. We've just celebrated 35 years of being an organisation at the heart of Merton as a community, really. We're responsible for developing volunteering opportunities, delivering social prescribing in Merton. We're also a founding partner of Merton Giving and host Health Watch Merton. I think importantly for this conversation as well, we're a key partner in Merton's COVID-19 community response hub, where we've supported over 3,500 local residents during that period. So today I'm speaking really from a community perspective. I'm really glad to be asked to join the discussion. At Merton Connected, it's one of our themes for this year, of course, to kind of improve capacity and capability to make sure that we can emerge strongly from the pandemic as a community and as a sector. So yeah, really looking forward to the discussion and questions too.
Yeah, thank you, Abby. I think, yeah, the voluntary sector has played an important part as well. So I think it was very good of you to join us. So I'm going to hand over now to Dr. Mohan. We've got a short presentation and then we're going to go right into the Q&A. Thank you.
Thanks, Martin. I think we're going to Sadina, actually. Sadina's going to start us off.
Okay. Are you going to put the slides up, Martin?
My colleague Lourdes
has got them. Okay, can I have the next slide then, please? Okay, so as we said in the beginning, today's session is about sharing with you what we know about the vaccine and helping you all to build confidence and optimism around having the vaccine. The presentation will answer some key concerns that we've heard from young people, which is about how safe is the vaccine? Does it affect my fertility? How effective is the vaccine? How do I get hold of a vaccine? And what are the side effects that I might experience as part of the having the immunization? And we're keen to hear your views and answer any questions that you have at the end of the session. So if you've got any burning questions, if you hold on to them to the end, then we will have a question and answer session if we haven't answered your question in the presentation. So the key and most important thing is that the vaccine is safe, okay? So in the UK alone, over 60 million people have had a vaccine, one or the other of what we have here in the UK. But just to rewind the clock a little bit and talk about vaccinations generally. So vaccinations have revolutionized global health. There are so many vaccines, and a baby born today will have close to 6 vaccinations in one day at that one sitting when they go for their vaccine. So vaccines are not new. They are the single most life-saving innovation in the history of medicine, because there are, if you look back in history, there were so many horrible diseases that plagued the world, like TB, smallpox, measles, things that we actually don't see anymore thanks to vaccines. And the first half of the 20th century led to vaccines that protected against whooping cough, diphtheria, tetanus, influenza, and mumps. And these are all still vaccines that we use to protect ourselves today. And more recently, we've had vaccines like polio, measles, rubella. And in 1990, it was announced that the world was smallpox free. And for me, as a pharmacy student, I did my final year project on smallpox. So I studied just, how devastating smallpox was, but also how effective the vaccines have been to eradicate smallpox. Can I have the next slide, please? So I get asked a lot about the COVID-19 vaccine and how it was developed and how come we got it so quickly? And people ask me lots of questions. Well, I think it's important to realize that if we rewind the clock back to March 2020, the whole world was in a very desperate position. And it's been a very long time since the whole world was in such a position. And so all our efforts across the world were focused on the development of something that would get us out of the position that we found ourselves with. And what it meant was that there was a lot of collaboration. Scientists were speaking to scientists, developers were speaking to developers, researchers were speaking to researchers. Everybody was talking about the vaccine. And what it meant was that not only was there work that already had been done at the research in the development of vaccines that was sitting there ready to be used, but everybody was sharing what they were learning. And that never really happens. Now, I've worked as a clinical trials pharmacist, and normally when a clinical trial is ongoing, the company it's a top secret to them. They don't share anything about it really until they've gone through the trials and they know, what they're finding. But in this particular case, that's not what happened. So as the trials were ongoing, the data was being shared, and it was also being shared with the bodies that were going to do the robust testing once the product was ready. So everything was kind of moving together rather than waiting for things to finish and then starting a phase, finishing it, then going on to the next one, going on to the next one. The other important thing about the development of the vaccine was that funding was provided by the government. Now, normally, when a pharmaceutical company is developing a product, they have to fund it and hope that at the end of all the trials that they'll come up with a product that can earn them their money back. But this time round, the governments, particularly the UK government, the US government, they put money behind these to say, as soon as you've got a vaccine, we want these doses for our people. And that's one of the reasons why we are blessed in the UK to have such an excellent vaccination program. It's thanks to the foresight of our government around backing these vaccines whilst they were in development. If I can have the next slide, please. So how does the COVID vaccine work? So you would have all seen pictures of the virus and the spike proteins and everything that goes with it. So just a little bit of basic immunology, and we've got a little video that will be shared with you all that kind of breaks how vaccines work down to very simple, and I thought very interesting way of explaining it. But in a nutshell, the vaccine trains our immune system to fight infection. So if you imagine our immune system to be an army, the vaccine is training the army to be able to fight the enemy when it comes across it. Okay, so some of the vaccines contain very small parts of a weakened virus, which is normally given in part of an injection, although we do have oral vaccines like polio, for instance. None of the COVID vaccines that we're using in the UK contain any live viruses, and they definitely don't contain any chips that track you. So there's a lot of misinformation going around about, well, if you have the vaccine, then you will be tracked. I can tell you for a fact, the mobile phones that we all carry, they're more of a tracking device than anything else. So the vaccine definitely doesn't track us. What happens is when you have the vaccine, it instructs your immune system and it creates the proteins that form the antibody. So basically it forms the fighters that are going to fight the army, fight the enemy when you're faced with the enemy, which is the COVID vaccine. So it gets them ready for when they're faced with this enemy, they know exactly what to do. And as I said, we've used vaccines for years, and our babies today in the UK can have anything up to 6 vaccines in one go, and they cope very well with it. So as adults, although we will remember what it was like as a baby to have our childhood immunizations, for us as adults, sometimes we're a bit nervous of injections and we don't know how it's going to work. But rest assured, these vaccines do work, and across our population, people are having vaccines all the time. Now, what vaccines are available in the UK? Well, there are quite a lot of vaccines worldwide. I think they're probably about 7 or 8 at the moment. But here in the UK, we have the 3 vaccines, which is the Pfizer-BioNTech vaccine, the Oxford-AstraZeneca vaccine, and the Moderna vaccine. Now, all 3 of these vaccines have been tested rigorously by our regulatory authority, which is called the Medicines and Healthcare Regulatory Authority, which we call the MHRA. And the MHRA have reviewed all the data, looked at all the evidence, looked at all the trials, and they have deemed these safe for use in the UK. So regardless of which of these that you have, be rest assured that it is safe for you and it is effective. Can I have the next slide, please? So these are the two main vaccines that we're using here in Merton. There is one site that is part of a pilot using the Moderna vaccine, but the majority of our residents in Merton would have had these 2 vaccines. Now, as you can see, these are the things that the vaccines contain. So you can see there's no animal products, there are no chips. And when you come into our clinic, these lists are available, because if you were to have an allergy to anything within this, then we would have to have a discussion about what might be the best thing for you. Could I have the next slide, please? Which vaccine is suitable for me? Well, there's one thing to note is that all the vaccines are suitable for most of us. There are very few occasions where we would say, okay, you shouldn't have this one because of a clinical reason. So I'm just going to go through some of the issues. So allergy is one of the first things. So when you come into our clinic, you will be screened for allergies. And If you have a known allergy to anything in the vaccine, then we won't be giving you that vaccine, and we'll be making arrangements for you to have an alternative. There is no evidence that says that the vaccine causes infertility or indeed erectile dysfunction. Lots of patients have had these vaccines and gone on to have successful pregnancies. And indeed, actually, at the moment, there are quite a lot of people, because of the age group they were vaccinating, there are quite a lot of patients that come into the clinic who are about to have their IVF, which is the in vitro fertilization treatments, to help them have a baby. And their consultants ask them to come in and have their vaccine so that they're in the best health when they go through the IVF process. It's also given to pregnant women. So when we started off originally, the evidence was suggesting that if the pregnant woman had a high risk of exposure to the vaccine, then it was important that a discussion was had with her and come to a conclusion of the best way forward for her. And as you can imagine, many of my colleagues in the NHS that were pregnant, that were working on all the wards and doing other patient-facing roles or coming into contact with a lot of people, there would have been many, many, many pregnant women amongst them, and many of them had the vaccine then. Since then, the evidence has moved on, and over 90,000 patients in the USA that were pregnant have had the vaccine safely, and quite a number of people in the UK that have been pregnant have had it as well. So we now recommend that pregnant women have their vaccine at the same time that their age group is called forward for the vaccine, or indeed if they've got underlying conditions, if they're healthcare or social care or frontline worker, if they have a learning disability, or if they were in the original, absolutely they needed to have it. The other thing that you would have all heard a lot about is the blood clotting, very, 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 very minuscule risk of a blood clot after the AstraZeneca vaccine. And as a precaution in the UK, patients aged 18 to 39 will be offered an alternative vaccine to the Oxford AstraZeneca vaccine. And that alternative is either the Pfizer or the Moderna vaccine. Now, the risk of blood clotting, as I said, is extremely small. So we're talking about just over 10 people for every million develop this condition. And the benefits of the vaccine outweigh the risks for a lot of people. So it's about a risk versus benefit discussion. So if I give you an example, so if you were a young person, okay, if you worked in the NHS, for instance, and you worked in a job where you came into contact with a lot of people, let's just imagine that you were of Afro-Caribbean background, because we know that in the pandemic, there was a higher incidence of COVID in the Afro-Caribbean, on the Asian populations, and just imagine that you were diabetic. So you've got quite a number of risks for COVID. It will be absolutely vital that you have the vaccine, because actually you have a very, 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 very tiny risk of having any complications, Pfizer or a Moderna vaccine where it's available. But I can tell you that there are many patients who come into the clinic who are in that age group who are happy to have the AstraZeneca vaccine. So as long as we've explained to them what the risks could be, the decision then is down to the patient whether they want to have the AstraZeneca vaccine that we might be offering at that time, or whether they want to wait and have a Pfizer vaccine. So we then would arrange for them to have a Pfizer vaccine, or we would direct them to a clinic that's doing a Pfizer vaccine. Could I have the next slide, please? So the vaccine is effective. Now, if we cast our minds back to maybe January this year, when the figures of people that were losing their lives and the number of people that had the infection was extremely high. It was rather heartbreaking to see. And at that time, we just started the vaccination. And, you know, from all the evidence, we knew that the vaccine would offer us some protection. And we knew that it would prevent against serious disease and it would prevent against hospitalization and death. But we had absolutely no idea how much it would do that. And yet, in the last few weeks, we've seen the figures for ourselves, about 70 to 80% reduction in serious illness, in hospitalization, and in death. We've had days in London where there have been no deaths at all, which has been absolutely wonderful, really, to see. So we know that the vaccine is effective. And actually, we saw that the vaccine was effective even after just the first doses. We had started to see the benefits. So we know that it's effective. And so it's quite important that we immunize as many people as possible. Can I have the next slide, please? How effective are they? Well, more than 36 million in the UK have had the first dose, and over 20 million have had the second dose. Okay, and we know that when you've had 2 doses of either of the vaccines, you have high levels of protection against mortality. Now, the interesting thing is that actually these vaccines have even a higher level of efficacy than some of the other vaccines that we've known and used for years. So they're actually quite remarkable innovations in science, really. And after all, when you remember what I said about the collaboration that went into it, it's hardly surprising because we've had the best brains working on these vaccines. Can I have the next slide, please? So the impact of having vaccination. So people that are vaccinated are less likely to get COVID with symptoms. They're less likely to get serious COVID infections. They're less likely to be admitted to hospital, and they're less likely to die from it. And vaccinated people are less likely to transmit the virus to others. And by April 2021, the vaccine had already saved more than 11,700 lives and had prevented 33,000 hospitalizations. And we know that that data is getting better and better day by day as more and more people have their vaccines. Can I have the next slide, please? Will the vaccines work with the new strains? Well, the vaccines are one of the tools that we have to prevent outbreaks. And as you heard from Dagmar, there are lots of things that our public health colleagues do to work with the system to control outbreaks and to handle any outbreaks that do come and to prevent outbreaks. So the vaccine is one of the things. And we also now know that the vaccines that we have are effective against many of the strains that we've seen. So we've had the Kent strain, we've had the Brazilian strain, we've now got the Indian strain in our midst. And I always find it interesting that they're named after perhaps where they're first seen. And it almost gives people a false impression because actually these viruses are mutating wherever they are. So they haven't necessarily come from places, but that's the name that they get given. So that strain is here with us in the UK. So the key thing is that we all need to remember that having the vaccination is a good thing to do. It is safe, it's effective. It will give us the best protection against the coronavirus, but we also have to continue to do all the right things. And the hands, face, space, fresh air is important. So we still need to do that. We need to be aware of unverified information on social media. Just today, I saw another video of somebody talking about things that you think, well, in what authority are they saying that? Is that true? When we come across these videos, we need to check sources to find out, is this true, rather than passing it on and then people start to panic. So that's an important thing. But also we need to look after our health, because we also know that in the pandemic, people that had long-term conditions or sort of any health conditions, their outcomes were worse. So what we can do is to stay healthy, stopping smoking, reducing alcohol consumption, eating healthily, and keeping active will all help us in our quest to conquer this virus. I'm going to pass now over to Dr. Mohan, who's going to talk about the accessibility of the vaccine.
Thanks, Adina. That's great. And I think we've covered a great part of it. And certainly the rollout of phase 2 COVID vaccinations, we've done a fair amount of population in Merton. Merton, the resident population is around 208,000. Dagmar, you might need to correct me. And we've vaccinated over 105,000 in Merton. So we're well on the way to supporting the population in Merton. So the programme started off in a staged way. So we started off with the most vulnerable first, and we worked our way down. So now we're on category aged, those 40 to 49 and 30 to 39. Those under the age of 30 are likely to have had a long-term condition, which is why they had the vaccination. Thank you. Next slide, please. So what happens when you get your vaccine? So there's quite a bit of apprehension about what happens when you go to the vaccination hub. So you'll go there. It's well stocked. It's a perfect machine. Now we have volunteers who are by the entrance, and they will kind of welcome you in and take your name, make sure you haven't got any COVID type symptoms. and then they'll move you into the main part of the vaccination hub, where there'll be a nurse or a doc or someone who will be able to vaccinate. They'll also ask some questions to make sure that you answer all your questions. And then if it's a Pfizer vaccine, you'll stay in the observation bay for 15 minutes. If it's the AstraZeneca, then you don't need to wait to be observed. So you'll have your 2 doses. So the first dose will be week 1, and you'll be invited to get your second dose from 8 weeks. That was previously 12 weeks, but that's now been brought back to 8 weeks. And we aim to get everyone vaccinated by July 21, so almost next month, 6 weeks away, which is great. And so after about 3 weeks from having your dose, you'll start getting some protection. It's really important that we go and get the second dose, though, to make sure that we improve the effectiveness of the virus, of the vaccine. Next slide, please. So of all the vaccination hubs we have, we've got plenty now in Merton. So we're all working together to get the population of Merton vaccinated. So we've got the Nelson Health Centre, and we've also got the Wilson Centre, which were the 2 first sort of hub centres in Merton, and they've been going on since the middle of December 14. And moving on from that, we had the Centre Court Shopping Centre, which is a mass vaccination site, as well as the AFC Wimbledon vaccination centre. And now the community pharmacy on Grand Drive is providing vaccination as well. So really, really positive to see. And there's plenty of pop-up sites as well in various faith groups, so in churches, mosques, community centres. They've all been done to outreach and support or vaccinate people who find it hard to get to health centres. Thank you. So yeah, the big question, does COVID-19 vaccine have any side effects? The main side effect you get from the virus is a sore arm, for where the needle went into the arm. And so that may feel sore for a day or so. 1 in 4 people may get flu-like symptoms, and they're things like headache, muscle ache, joint aches, chills, nausea, or vomiting. Now, that's not an allergic reaction. That's a sort of a vaccine side effect. And so that normally lasts a couple of days. Certainly if it lasts longer than that, or up to 4 to 5 days, then we ask you to seek some help or get some medical attention. But by and large, they tend to be fairly minor, the side effects, but they do exist. So that's the important thing. I think some people felt that there weren't any, and when it does happen, they got a nasty surprise. Thank you. Next slide, please. And then we're on to your questions. So any questions?
Thank you, Mohan. Sorry, I'm just yeah. So I think we can, yeah. So yeah, feel free to either leave your camera on or off, and I've got a few questions, so I'll start it up, and then do feel free to ask. There's really no order. You can put your hand up. You can also write it on the chat. And like I'm saying, most of the session is going to be the questions. So I suppose the first question is why has the government said that AstraZeneca will not be available for under 39, for the under 39s? That's my first question. And literally feel free. I don't know if I can give that tomorrow. I think you've just mentioned it, but yeah, I had that from before, so. Okay,
I'm happy to start with that one. So, the option will be given to under 39-year-olds to ask if they want to have an alternative vaccine. So the option will be there. So it's not that they can't have it, it's just that they'll be given the option, and they'll have that counselling sort of discussion with the patient and the healthcare professional about whether they want to have the AstraZeneca or something else. So that's the only difference. So patients or people or individuals above 39 won't be offered that choice, because the benefits far outweigh the risks, whereas when you come under 39, the risk slightly increases, and therefore that's why the option is given.
Bohan, sorry.
Good. Oh.
Sorry, go on.
I was just a quick question. What about those like 25-year-olds who have had the first one, which is AstraZeneca? What's going to happen? Are they meant to change now and have another vaccine?
So the guidance is that if you've had your AstraZeneca first vaccine and you're under the age of 39 and you've had no severe side effects, then you continue to complete the course and have the second dose of AstraZeneca, because it's unlikely that you get a reaction because you've had it first time around.
If you have, if you have issues that, for example, like blood clot issues that have arisen, not as part of the vaccine, but there's still an issue that that has yet to be diagnosed, for example, or is in the process of being treated. Should you still be getting the second dose of the AstraZeneca/Oxford vaccination?
So if you've had the first dose, you've had no side effects, then you can have the second dose. If there's concern about your individual case, you've had a previous clot or you've had something in between your first and second dose, then yes, I would certainly have a discussion with a clinician or someone from your practice about that. You need to probably check that out. Every case will be slightly different. Yeah.
Thank you.
Yeah.
Okay, got a question here on the chat. What would you say to those who have concerns about people getting the vaccine when it has only been around for a year, isn't officially FDA approved yet?
I'll answer that. So what I would say to that person is in March 2020, we found ourselves in a very difficult position. And yet within 8 months, we've managed to come up with at least two products here in the UK that we're using, well, 3 products that we're using and more in record time that have saved lives. I often say to people to think about all the volunteers who stepped forward to do these clinical trials, when at that point we knew absolutely nothing about vaccines. And yet now somebody who is walking into a clinic to have a vaccine has got all the information from the millions across the world who've had it and have been safe. So I think everybody will make a decision that is right for themselves, but many have gone before that person and it's worked fine and it's not been a problem. So the question is, people think about, well, what could happen in 10 years time or 5 years time or what have you. The question is, you want to live to get to that time to see what happens. And if you don't have the vaccine, you might not live to see what happens in 5 or 10 years time. So it's a choice that people have to make. We know it's the right thing to do because we can see it saving lives. And that person will be having the vaccine, not just for themselves, for their family, their friends, their community, and for society at large. So yeah, and if they have any more questions that they want to ask me, I would sit and listen to them and help them make their decision.
Yeah. And I also maybe chip in, just from my point of view, it's really also trying to think about how you think about risk, because obviously all things we do, even if we step out of the house in the morning, carries a risk. You know, we can be run over by a car or you name it. So for me, it is quite important to find out what is the risk thinking of people if they feel particularly anxious around the vaccine, because we do all sorts of other things that objectively have a lower risk. Yeah, so I would tune in and really drill down a little bit what it is that this particular risk is feared so much. The other thing that I often think about is really in young people, clearly the epidemiology shows that they haven't had a lot of acute COVID, but some have. And there is still this issue around long COVID. And long COVID is a real nasty, ill understood issue. And it doesn't skip young people. So I, for example, I happen to have quite a close colleague who was such a sporty person and, you know, wiped out unbelievable. So it sometimes brings it home to me again, because I've got youngsters, my kids, one of my kids said, oh, you know, I don't need it, I'm sort of won't get it seriously. And I say, look what can happen. So consider the lot when you think about risks.
Yeah, if I could just add to that, so pretty similar to what Sadina was saying. It's true, we don't know the long-term effects of the vaccine, but we certainly do know the short-term effects. And if we cast our way back from last year, we had no way out. We were just fighting this virus, and we were all in lockdown. And it was quite a new thing, but certainly as the year went on, being locked in and not being able to have do your normal living was really affecting a lot of our mental health. And this year we're really suffering as a result of that. And if we don't get over this virus, then we're going to have some serious mental health problems as a result of being unnaturally locked up. So we need to get through this as quickly as we can. And the best way of doing that is by having the vaccination, so that we can start getting back to some sort of normality. So I think a combination of all those answers, I would tell your friend. Thank you.
Got another question. The government made many mistakes, such as not going into lockdown early enough and not closing down the airports. With so many failures during the pandemic, why should we believe you now?
Yes, that's a fair point. But I think it would be fair also to say that going back to March 2020, and as we went along, everybody was doing what they thought was best at the time. And I think when we look back on this pandemic in years to come, the steps that everybody made across the world, our government and other governments, will make an interesting read. But what I would say is that when it's come to the vaccination, there's been a lot of evidence that we the people are seeing that has shown the benefit. So we're not being told necessarily by the government that this vaccine is effective. We are seeing it ourselves. We're living it every day. As the UK is unlocking, thanks to the vaccination program, we are able to follow the roadmap, and we have been able to meet all the milestones that the government has set. So I don't dispute that we all have different views on what our UK government has done right or not done right. No doubt we all have our views. But I think you will agree with me that when it comes to the vaccination, is the one thing that we all agree on, really. I don't hear people disagreeing with the figures that we are seeing, that the benefits of the vaccine. And it's not just ourselves in the UK, it's people across the world looking at the UK and in admiration for the work that we've done.
Yeah, I would just add as well, I think, yes, maybe we didn't go into lockdown too late, but it's a pandemic. You know, these don't come around every week or every month, and hopefully never again in a lifetime, even though we're not quite out of this one. But you know, there isn't a blueprint of when to close, when to open, when to do this. And I think there's been lots of lessons learned, and we're still in kind of semi-lockdown now, aren't we? And so we've had this extended one just to make sure that we get it right. So I think they've certainly learned from that. And certainly, as Sabina was saying, we're learning from what the vaccines can do, and certainly that's reduced infection rates, reduced hospital admissions, and allowed us to have some of this easing of our life back. So I would say that it's all working in a positive way to come out of this in the best way we can.
And can I also chip in, because it was quite interesting. I have some sympathy with your judgment, although I have to be a bit careful, obviously working in public health. But I'm coming from Germany, so from Europe, and it was very interesting that initially in the pandemic, Germany was actually hailed as quite a country with a good grip, and that had a good contact tracing, and the Robert Koch Institute, you will remember. And then when you look what the EU did in terms of vaccination, it was a bit of a dog's dinner. And I say that, although I'm obviously from Europe. So for me, it's really interesting that there's hardly a country globally that did get everything right. But there's absolutely, I think, globally, the judgment that what the UK got right is the vaccination. So there is real admiration. If I speak to my colleagues, friends, family over in Europe, they said, God, you are so lucky because you've pushed your vaccination. And if you think as well, NHS test and trace, for example, is the outfit that I had to deal with, and I have quite a lot of reservations how some of that stuff went. The vaccination was actually handled by the NHS. The NHS is an institution with a long and solid history, and so in terms of trust, I feel no wonder that that bit of the pandemic has worked so well.
Thank you for all your thoughts. I'm going to go to the next question, and then I'm going to come to, well, actually, I'll go to, because we're on the topic of this. So do we use other countries as case studies to better regulate restrictions? So for example, in Chile, over half of the population was vaccinated, but there has been an overwhelming impact due to variants. What can we learn from this?
Shall I take that? Because I think the Chile example is really interesting. They were another country we were quite in admiration. And it was very interesting because they obviously have their summer when we have the winter. And in hindsight, and hindsight is obviously always easier, the people were desperate to have their summer holidays. And although the infection rates weren't quite low enough, they said, oh, we make progress with the vaccination. So in hindsight, the judgment is they have they opened up the lockdown too early. And the other issue is what vaccine did they use? So people had their first vaccine, but not the second one before they opened up and had their holiday. So it shows you the precarious and fragile situation we are still in. And so that's why I feel as well, it is really now almost a race between the vaccination and that virus, because what happens with the virus, it mutates all the time. And if we allow infections happening, even in the younger people with less hospitalization, it means the virus has the opportunity to breed new variants. So at the moment, we're still lucky enough that the vaccines we use are pretty effective when we have 2 doses against all the variants, including the latest originating in India. But if we're not careful, that virus can outwit us and can produce a variant that might escape the vaccine. So if we vaccinate quickly, we suppress the infections, then much less mutation. So that is quite an important consideration.
So if I hear you correctly, then what you're saying is, if we have a sector of the population that don't get vaccinated, they can catch COVID and make a new variant. Is that what you said?
Yeah.
Thanks. Does anybody want to take that question?
No, I think Dagmar has explained it quite succinctly and accurately. Yeah, that's basically it.
I've got a next question. So BAME communities, and I'm going to say Black and minority ethnic because I think BAME is a lazy term, but Black and minority ethnic communities had a higher death rate than white ethnicities. Can you explain why this happened?
Can I start with that? Obviously, my panel do support me. Yes, absolutely. These are the stark facts, and research is being refined, but the bottom line is absolutely ethnic and minority groups had more infections, they had more admissions, they had more serious illness, and they had more death. And the causes are multifactorial, but for me, there is a really important message. The main causes are pretty simple, and we knew them before. Their deprivation, their housing, poor housing, overcrowded housing, crappy housing, not just the slightly romanticized multi-generational households. We are talking crammed, crappy housing, and jobs that are exposed to a lot of other people, poorly paid jobs, jobs where you have little agency, where you don't dare asking for your PPE. So that is the stark reality, because those conditions are associated with lots of people from ethnic minority groups. And for me, there was really quite a little bit of trying to hide, oh, we need more research. Yes, we do need more research in order to find the best solutions, but actually running away from that stark reality. These are socially patterned reasons, and for socially patterned reasons, we can do something. Now, people will say, oh, but it's also long-term conditions. It is true, and my clinical colleagues are here. But if you think about those long-term conditions, let's just take diabetes. Yeah. Who suffered most? It was people who had diabetes. Diabetes is a preventable disease. People had particularly poor outcomes when their disease was poorly controlled. Prevention and good or bad control of long-term conditions is socially patterned. So I don't think that we can run away. And what I had a lot of discussions after the first wave across London as well. And I heard a lot of feedback that a lot of people from ethnic minority groups begged me and said, please don't stigmatize us now. Yeah, to say, oh my God, you know, now we have it on our forehead. We are more COVID susceptible, and then we don't get any jobs. So I think we have to be very careful. And I'm really glad, in a way, in the council, we had the Health and Wellbeing Board recently, that there is quite some outspokenness to say, if you look in history, epidemics throughout history have always ravaged the poor the worst. And we've seen it in the 21st century, and we need to do something about it.
Thank you. Anyone want to jump in on that question? I mean, I thought it was answered pretty well as well.
Yeah, no, I think Dagmar's answered it very well. I think that the issue now is, you know, what are we going to do about it? How can we all do something about it? Because we all have a role in doing something about it. Because as Dagmar also says, it's multifactorial. It's lots of different bits, many of which, if we did something about, could actually work towards doing something big about it. So I think for the young people listening in, it's about thinking, now that they've heard the answer of what the determinants are, is think about, well, so as communities, what can we do also to work with all the other parts of the system that need to work on this? What can we do as minority, ethnic minority groups to do something about it?
Yeah, I would add, sort of summarise what Dagmar's mentioned, and certainly we know that it affects Black and minority ethnics more aggressively, and we need to make sure we don't stigmatise, but we also need to increase the uptake of vaccine in these groups, which seems to be a challenge, which is why we're sort of engaging and finding out why. So I'd probably like to ask a question: why, you know, any groups out here who may think that they're finding it difficult, or what they've heard, or what we might be able to do more of in order to get confidence up. That would be a question for me to the group, if anyone could answer that. But I agree. I think it's all of us together. It's not just that person. It's all of us trying to get through this together. Thanks.
Yeah, I mean, that was actually my next question, and I think if anybody wants to answer that, but there's a lot of mistrust from BAME communities, and you can see why that could stem from what happened in the first and the second wave, because you know, we had death rates that were a lot higher, and therefore you just think, why is that happening? So many people can come to like very simple conclusions and say, well, that's what they want to happen, and actually, like you're saying, it's multifactorial. But you can see why then that impacts on the hesitancy to get the vaccine. And so I suppose my question to all of the panel would be, what are you doing to tackle vaccine hesitancy within your jobs?
Okay, so I spend a lot of time on vaccine hesitancy webinars, which is why I'm with you this evening. When Mohan was talking about the vaccination, the photo on there was a photo of my arm. So it was me having my vaccine. So for me, as a healthcare professional from a minority ethnic group, I made sure that I had read all about the vaccine, that I felt confident enough to speak to other people about it. But I spend a lot of my time listening to people, because as Dagmar also mentioned, you need to kind of explore with people what the reasons for the hesitancy or the mistrust are. So I think it's important for different ethnic groups to see people like me who have had the vaccine, people like me who work with the vaccine. And I often say to people, you know, I'm more than happy for people to come to the clinic when I'm there, to see for themselves that different people are having the vaccine. So when we open a vial of the Pfizer vaccine, there's 6 doses in it. Those 6 doses don't all go to minority ethnic patients. The first patient may be of an Asian origin, the second one might be of a Caucasian origin, the third might be of a African origin, the 5th might be a Caribbean. They're mixed people. So it's not as if a specific vaccine is being made available just to minority ethnic groups, because like you said, you know, from the first and second wave, we saw that there was a higher incidence of poorer outcomes, and Dagmar has explained what the reasons for that are. But when it comes to the vaccine, it's not a special vaccine made for minority ethnics. It's not a special clinic even designed for people of a certain ethnicity. We're all having this vaccine together, and the outcomes are all stark in all of the groups. So in my job, it is my job to work with people to uncover what it is that is creating the hesitancy, and working with them to do something about those things, you know, where I can. You know, so mistrust is a huge thing, and I absolutely understand some of the roots of the mistrust. I often say to people, I understand, I get it. I get why people will feel, I get why people won't trust. But I also see, you know, the benefits of the vaccines. And I desperately want those benefits to be evident in the minority ethnic groups as well. But if people don't feel they're able to have it, then we're not going to see that. So if we're not careful, we will see a difference in the benefits in the benefits of the vaccine in the different groups. But a lot of that will be driven by the fact that the vaccine may have been taken up, had a higher take up in certain groups. So we're able to see those benefits. So for me, I want to be able to show a chart that says, look at the benefits of the vaccine across all the ethnic groups. It is absolutely wonderful, because we've had a uniform uptake of the vaccine. And sadly, at the moment, that isn't necessarily the case, because we have lower uptake in some groups. So it is all of our jobs, all of us on the panel's jobs here, to work with those groups so that they too can see those benefits, because they're entitled to have those benefits just like any other group of patients, really.
I was just going to add, so it's a very good question about mistrust, and I'm actually going to say something similar to what I said to the Health and Wellbeing Board yesterday. Was actually, I think we always knew that mistrust did exist, and it's taken this pandemic to realise how big it is. We're in the middle of a pandemic, there's still this mistrust, and it's like, wow, you know, this is big, and so we're trying to support that. And I've actually got a second question: is how can we improve that mistrust between us and the community? What else do we need to do to get people on board, or get ethnic groups on board? Not just for the vaccine, but I think for other long-term conditions and the longevity of other things to support what your needs are. And I think there's a bigger question there. In terms of what we've done, webinars, we've done outreach in clinics. I joined a team called Team Halo, which is a UN-backed initiative to try and support vaccine confidence, and even found myself on TikTok, of all things, trying to improve you know, vaccine uptake. So yeah, I'm on that. So we're all kind of doing things, you know, trying to be flexible and trying to get the message out there. But for me, it's that trust thing in terms of what will really support that trust thing. And I do ask you what could do that bit. But yeah, as Sadina said, the vaccine's there We're doing what we can, and yeah, I think Merton's in a good place, but we could be in a better place.
Thank you. Abby, did you want to jump in?
Yeah, thank you, Martin. I think really I was just going to echo the point that Mohan's made. I think, you know, on the flip side of being, you know, in laser focus as a community, because of, you know, the kind of outcomes that we've had, is that we have an opportunity really as well to you know, to speak up and to be heard and to voice what we need and what we, you know, understand are our own kind of fears or hesitancies or issues. So I think really just to encourage people to, you know, be opportunistic and take that opportunity to get involved and to kind of, you know, make known your needs at this time. I think, you know, there are plenty of initiatives to do that. I think, you know, we mentioned the kind of research registry for the vaccine kind of program, and various other routes as well to kind of show your support and get involved in you know, initiatives around improving vaccine uptake and understanding kind of what the issues or barriers might be. So yeah, really just to echo that point as well.
That's perfect.
Just to bring light to what Kaz has put in the chat. The local NHS also has a public engagement team locally that has been working with colleagues in public health, community champions, local doctors, and voluntary sector organizations. They have organized 54 events and reached over 1,200 local residents from communities hit hardest by the pandemic. They are prioritizing groups where they see the lower uptake. As panelists have said, we aren't shying away from acknowledging legitimate reasons for mistrust.
Thank you. I'm going to bring it to one of the questions I received on Eventbrite, if you guys don't mind, because I thought this was a good one. And I think in a way, Dagmar's answered it, but I just feel like it's better for me to ask the question. So why should relative young people get the COVID vaccine, given that young people are much less likely to get seriously ill?
Is that the end of the question? So I suppose the answer is it's not. I mean, that's not exactly true, is it? So COVID is not discriminative. It doesn't care how old you are. It can get anyone from all ages, and so we all need to protect against this. I think it also protects yourself, but it also protects your loved ones as well. If you're less likely to be infected, then you're less likely to pass it on to a nan or an elderly relative or vulnerable person. And also the third point would be around the mutations as well. The more people who are not vaccinated against the vaccine, the more it's going to be in our gene pool, or in our pool, I should say, and therefore it's more likely to change, which means that it'll be hanging around a lot longer. So I think 3 reasons there. And I think it doesn't, even though people are older or vulnerable groups are more risk, it still affects all ages. And even now we've got younger patients in the hospitals.
And can I just chip in as well, because I was really intrigued. The NHS, together with the local authority, they did quite a large engagement and survey around younger people to say, well, what's the reason? Why do you vaccinate? Because we know that you can get COVID, but the risk is lower. So that, I think, is a given. And actually, particularly in the younger age groups, quite a number answered back, because I want to protect others. So for me, there is something quite important to speak that out as well. It is a solidarity principle. There are other things in society which are solidarity. Taxes are solidarity. Yeah, the richest pay so that all of us can have some basic services. So a reminder of that. And I think it brings it home if you've got a vulnerable friend or relative who cannot be vaccinated, and there are always a few out there, you know, somebody who's on chemo or so, they absolutely rely on the solidarity of the people around you. It's the same with all other vaccinations. And so just stressing it, and I was quite moved in a way that the youngest cohort was most outspoken to say, actually, that chimes with me, that is a reason. It's not just myself, it is the protection for the others.
Thank you. I'm going to move it to the next question. So there is talk of getting a vaccine yearly. would this many vaccines have an impact on our immune system and have negative side effects?
I'll answer that. So yes, there is talk of having a booster, and there are trials undergoing at the moment about that. So we're all waiting to see what the decisions then are made about what other vaccines, as in what boosters we would have and when and who would have it and etc. So we're waiting to hear that. But the second part of the question, will it have a negative impact on our immunity? Well, the flu vaccine is something that's given every year and it hasn't had a negative impact on our immunity. So there's no reason to believe that that would be the case in this case. And there are other vaccines that are used frequently as well. So I have no reason to believe that will be the case. And I don't know if Dagmar or Mohan know of any reason why that could be the case.
Yeah, so I completely agree, Sedina. So from a scientific point of view, there is no plausibility to say it does any damage to the immune system. Indeed, there is anecdotal, and it's important to say we haven't got studies, but there's anecdotal anxiety that with all this lockdown and no social contact, that our immune system might be a bit understimulated, and some of our respiratory predictions for non-COVID infections for this winter are modeling and saying, oh, because we haven't had any contact for over a year, we are preparing, particularly for children, but also for adults, for more outbreaks for other minor respiratory illnesses. So it shows you more the opposite, that if you don't keep the immune system stimulated, that is probably more of a risk than anything else. So no scientific plausibility that I can see.
Thank you. I mean, I just want to let everyone know that if you want to ask a question, you can put your hand up. You can put it on the chat. I can ask it for you. And the conversation doesn't end here, because after this, we're going to send you the PDF, and you can email questions in as well. So it's not like, you didn't get to ask today, you didn't have the question today, maybe you got that next week. You can still ask in the future. But yeah, I mean, I suppose, sorry, Lourdes, do you have any question?
Yeah, so I wanted to ask about other things that we can do to other preventative measures. So there's been quite a lot of scientific research done around around vitamins, specifically vitamin D and its role in preventing or not necessarily preventing, but having a higher rate of success with surviving in COVID and making your immune system stronger. Is there any other thing like that we can do?
I mean, I think there's prehabilitation, isn't there, which we is trying to prepare someone to be as fit as they are, so that they can fight any infection. And I suppose vitamin D kind of falls into that bracket, doesn't it? If you're lacking a bit of vitamin D, then you would have replenished that to a level which is what your body should be having, and therefore you're more likely to be healthier and stronger, rather than having a low vitamin D. So I wouldn't take any extra vitamin D. I'm not, but I would say that it's like with all things, you want to try and get yourself as healthy as possible to be more in combative mode to fight infection. That'd be my answer. I don't know whether Dagmar, Sedina have anything else.
Yeah, so I think there's always a bit of a temptation. If only there's a pill I could pop, then the hard work is somehow I can escape, and it doesn't work. Yes, so if you are actually vitamin D deprived, then you need to replenish it. But popping the vitamin D and then staying on the sofa is not cutting it. That's just the bottom message, and it's hard for all of us. What I think, though, in terms of research is also important is that quite a lot of and really good research is happening on treatment. Now, me as a public health person, of course, I think prevention is better than treatment anytime, and the vaccination is the best, by far the best tool in our prevention toolkit. But if it so happens that it hits you, God, we would be better off if we could treat better. And you will have heard about the dexamethasone. That was quite a breakthrough. And it was actually really quite fantastic research. And it was from this country. I think credit where credit is due. So there is still a lot of research going on that says, God, if it hits us, how can we treat it better? So far, apart from the dexamethasone, no big breakthrough yet, but lots of trials going on. So some success might be on the horizon there.
Dagmar, sorry to interrupt. Could you please highlight or expand on what is the drug that you?
Oh, sorry, dexamethasone. It's a commonly used, sorry for the jargon, it's a commonly used steroid drug that has been used for many years to suppress bad inflammation. And as you probably will have heard, is that particularly severe COVID, the immune system almost goes out of control. And the inflammation that is caused by the reaction is worse than the virus itself. And only in those serious cases, this steroid therapy seems to increase survival. But have I said that? Because my clinical practice, jobbing clinicians might say that better.
No, you've absolutely. So as a pharmacist, many would think that my preference will be for people to take medicines, but actually quite the opposite. I think the fewer medicines people have to take, the better. So if you remember in the talk, I did say the important things are staying healthy and doing everything we can to be healthy. So, you know, stopping smoking, reducing alcohol consumption, eating healthily, keeping active, you know, doing those things is really important. But if you do have an underlying condition, it is about complying with your medication regime as well. So actually taking the medication that will keep you healthy is quite important as well. And so as a pharmacist, that for me, that's important. If you have been prescribed medication to take, please take it. But also if you have any issues with taking it, speak to your doctor or your pharmacist about it, or your nurse, whoever the healthcare professional that is looking after you, because there was no point. I meet many patients and I talk to them about their tablets. I said, well, I don't take that one because it gives me a headache. I don't take that one because it makes me sick. And I said, well, have you told the person who's prescribed it? And they, oh, I don't want to bother them. Well, the best tablets are the ones that you take and they work for you. The worst tablets are the ones that you have that you never take. So these are all the things that you need to do to stay healthy and also support others to do that. So that's the other thing. It's not always just about us. We might have friends, we might have family, maybe people we work with or people we play football with or what have you, who don't use their inhalers if they're asthmatic and then they're constantly out of breath. You know, we all have responsibility. We have to be each other's keepers as well in all of this. So it's about helping one another to keep healthy and stay healthy, is what I would say. And the fewer tablets, the better.
Yeah, we've got, I just want to end on, if you're not taking any medication, we've got a saying in Merton, don't medicalise. So certainly keep exercise, keep active, socialise and that. Well, not socialise yet in COVID, but definitely exercise. And then we'll hope to be socialising soon.
Actually, a question for Abby. In your point of view, what can we do going forward as individuals to tackle this?
Yeah, to tackle
COVID and like to tackle hesitation, apart from just word of mouth, sharing information, and specifically around our community.
Sure. So I think probably the first thing to say is, you know, we all have our roles in this, and I think that's right. And I think probably for Merton Connected and kind of the kind of council perspective, we've definitely prioritised, you know, support where it feels most urgent. So I think, you know, as part of the first kind of wave of response, the community response hub that I mentioned was set up really quickly. And that was a way that, you know, we could attract volunteers to support the community through, you know, all sorts of things. People were picking up shopping for people who weren't able to leave the house. They were walking dogs. They were answering phones just to give support to someone who might have been isolated. I think those were the kind of things that definitely, they've got us through in the waves where we've not been able to have the kind of community spirit that we were maybe used to in other ways of living. So I think for one, I'd kind of encourage that people continue to do those things for people that need them, and to think about people that maybe aren't being released from the lockdowns that we've had in the way that maybe other people are. I think that's going to be really important. I think on the kind of other side of that, where you could maybe do more on a personal level to kind of reach further into the community, there are lots of opportunities around kind of volunteering and youth volunteering, excuse me, to support the response that Merton Connected are involved in. So I think one of the things I'd mention is, of course, the kind of work that we do with these self-builders and Martin as youth inspectors to encourage young people to think about kind of their rights in a health setting and mental health kind of concerns. And these are the kind of things I think that we're talking about as part of a longer term and kind of more ongoing role in making sure that we come out of this in the right way. So I think, yeah, lots of opportunities for young people really to start to think about how we emerge from the pandemic and how we, kind of build back as well.
Thank you.
I think I would say for me, for one of the things that I was most glad about during the pandemic was the way young people buddied up with older people and helped them through some of the technical things. I could not believe the number of older people on TikTok doing things and actually loving it, although doing it virtually with their grandson or granddaughter or neighbor or what have you. So I think it showed us that actually, as much as we may see the generation gap as so big, the size of the generation gap actually had a lot to offer during the pandemic. And I think young people really stepped up and they really, really did help other people. They shared their skills that they had, that they use and in many circumstances take for granted, really. They realized that actually those little skills, just showing somebody, how to go onto Zoom. I mean, how many grannies and grandpas learned how to use Zoom and used it effectively over the pandemic to keep in touch with their family? Most of the time, it was the young people that did that. And certainly, amongst my friends, we have a joke about if you've got a problem with your IT, ask a young person. And I think young people need to be proud of those assets that they have, and we need to continue to use them as we come out of the pandemic, because they're still needed. And likewise, the young people learned a lot from the older people. Captain Tom Moore was a prime example. I happen to know a family that go to school with his son, and his grandson used to spend a lot of time with him, and together they learned a lot from each other. So I think it doesn't matter what section of society you are in, you have a lot to offer. And I think my message to the young people is, continue to do that, because, you will learn a lot, you will teach a lot, and it will benefit all of us.
Thank you.
I just wanted to ask one last question, which is related to just like COVID and just the vaccination. Actually, two quick ones, but let's make them quick because I don't want to keep people after. I think the first one is just about the cocktail of vaccines. So if you take one vaccine and then another vaccine, I've seen that from looking at side effects and reading some articles that can have a lot more side effects because you're having two different ones. And I suppose somebody is asking a question on Eventbrite as to if you, and I think you've mentioned this, but I just want to reiterate it. If you took the AstraZeneca vaccine, should you take the next AstraZeneca vaccine, or will you be offered a different one?
No. So the second bit first, if you had the AstraZeneca vaccine, unless you had some problems when you had the first AstraZeneca vaccine, you should have the second AstraZeneca vaccine. In relation to mixing the vaccines, there are trials ongoing looking at what the situation is with having two different vaccines. I can tell you now that in clinical practice, there will be patients who had an allergy to the first vaccine and so need to have a different one. So there are lots of people who are having different ones because of clinical reasons. And you know, as far as we know, there is nothing wrong with that. So there will be people who, for instance, had a Pfizer vaccine in hospital while they were there, and they're now home and they're housebound, and we can't take the Pfizer vaccine in to immunize them. So they may have a second AstraZeneca vaccine to complement the first one that they had. But we're waiting for the studies to tell us, you know, looking at larger numbers of these patients to observe what the pros and the cons might be for doing it, or whether any particular combinations are better than others.
Yeah. And the last question, do you think we will need to live with COVID just like the flu? Or do you think high vaccinations uptake, we may be able to eradicate it?
Maybe shall I chip in? Not that anybody has the crystal ball, but the term endemic is thrown around, and you might have come across it. So it is the anticipation that we can't eradicate it. If you think it is a global pandemic now, and we are luckily an open country and a metropolis that is not isolated like possibly an island, the assumption is that we will have to live with it, but that it will be low infection levels and not to an extent that we have to live with restrictions. That's my optimistic scenario.
I agree with you.
Thank you. I just wanted to end on, yeah, just like you're saying, the fact that it's obviously a global pandemic. If we have a high vaccination here, there's always a chance that through migration and through the airports, you know, it could still come in once again. And so just wanted to reiterate those points because it is global. But obviously what we're trying to do here is getting local people to ask the questions so they can feel confident to get the vaccine. And yeah, just the last bits of the presentation is just about how you can find that information related to us. So yeah, I just wanted to thank everyone so much for attending. This slide deck will be sent to you. And yeah, just wanted to remind everyone that although restrictions are easing, we're all going out again. COVID isn't going anywhere. Yeah, wash your hands, wear your face coverings before you enter shops, public transport and anywhere. Social distance and maintain 2 meters distance or as much as possible. Take a test regularly. It's quick, easy, and stops the spread of the virus. And then, yeah, there's going to be some links here as to like if you want to become a young adult COVID champion, and also here's our emails if you have any more questions that you weren't able to ask at the moment. And yeah, we're going to send you this and appendices. So yeah, I just wanted to really thank the panelists. So thank you, Dagmar, thank you, Mohan, thank you, Sedina, and thank you, Abby, for your time. It's been really, I want to say it's been really educational because at the end of the day, it's not my discipline. And just hearing it from you, it's been really good. And it's definitely built up a lot of my confidence. And I hope it's on the same for others. Lourdes, I don't know if you have any other final words.
Yeah, just to say, we will be emailing these out. Thank you so much to the panelists. Thank you so much for everyone attending. We really, really appreciate you making time to come through and to listen to listen to this information that we're providing. We hope to see you guys soon. Yeah, let's keep in touch. Thank you.
Just a last thing. I know you said thank you to the panelists, but Martin and Lourdes, just want to say thank you so much for your facilitation skills and for keeping us on the move with all the questions. So just really appreciate all your hard work as young inspectors in Merton. So well done. And clap, clap, clap.
Thank you, everyone. And also Sandra's here and she's going to be doing graphic minutes, so those will also be circulated. And here we go, we've got the virus is endemic, it's not going anywhere. So yeah, so just yeah, so there's going to be yeah, so thank you, everyone. I hope you have a lovely evening, and yeah, please keep in touch and let us know if you need anything or any other questions.
Thank you.
Thank you.
Thank you.
Bye.
Take care.
everyone.
Bye.
Bye.